Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're talking about lymphedema, a condition that affects the lymphatic system. There is no cure, but treatments are available.
We don't always know what causes lymphedema. Patients who get their lymph nodes removed from surgery, especially cancer surgery, are more susceptible to lymphedema, but it can happen in any patient. Sometimes it happens when we don't have a reason, and that's when we call it idiopathic, which can be particularly frustrating, but it's still the same treatment.
What are the symptoms of lymphedema?
The symptoms of lymphedema are swelling, and they can happen in the arm or the leg or even in the chest wall. I think it's particularly frustrating for patients that get lymphedema of the breast because it's not as easy to notice and it doesn't always get picked up as quickly.
What are the treatments?
The treatment is manual decompressive therapy and physical therapy or occupational therapy.
How does lymphedema affect breast cancer patients?
The most important thing about lymphedema is making sure there is not an underlying issue. And we certainly want the patient's cancer to be treated before we address their lymphedema. Once those issues have been addressed and they've been seen by their oncologist or primary care provider, then we do address the lymphedema. And if the cancer is all out of the breast, we can even work on breast tissue for lymphedema.
Do the seasons and temperatures have an effect on symptoms?
Absolutely. So lymphedema is more common in the summer with the hot weather, so we do see more cases of it. And a lot of times we'll have patients come in the spring just to assess them and make sure we're doing everything we can to prevent it during the warm summer months here in Massachusetts.